Well, Auckland's been shut off against the advice of the Director-General of Health. Keeping the city boundary closed for 2 weeks after the traffic light system began was not justified from a public health perspective, according to Dr. Bloomfield. Well, joining us right now is the COVID-19 Response Minister Chris Hipkins. Good morning to you, Minister. Why aren't our borders open now?
Well, look, to be clear, that wasn't the advice of the Director-General. The Director-General's advice was that Auckland and the rest of the country should move to the traffic light framework and the boundary should be removed from around Auckland at the same time, 2 weeks after Auckland had hit the 90% fully vaccinated target, which it's yet to do. So counties Manukau, they're still chasing down their last people to make sure that they're getting to that 90% fully vaccinated rate. So if we were waiting for that to happen, we'd be waiting till pretty much Christmas Eve at this point to be removing the boundary around Auckland and to be putting Auckland to the traffic light framework. We made the decision actually to move sooner than that and to provide an absolute certain date around when the boundary would be removed around Auckland. So we've actually kind of moved quicker than what the public health advice was.
Can you sort of understand that by keeping up the border for another 12 days after Dr. Bloomfield's suggestion, you might be sort of accused of being out of touch with, you know, the anxieties that many of the people in Auckland have been feeling?
Oh, look, I fully understand that Aucklanders have done some pretty hard yards for the rest of the country over the last few months, and I think we all owe them a great big vote of thanks for that. Ultimately, we made the decision to bring forward the movement to the traffic light framework to give them more freedom, to acknowledge that Aucklanders actually do deserve to be able to move around more freely. We made the decision to bring that forward in acknowledgement of that, but keeping the boundary in place while we continue to chase down that 90% vaccination target around the rest of the country is actually really important. We will hit 90% of New Zealand adults fully vaccinated before the boundary around Auckland is removed. Now, that provides a huge layer of extra protection because we know that when that boundary comes down, there will be a spread of COVID-19 at a greater rate outside of the Auckland area. And so we want the country to be as best prepared as possible for that.
Why was so much of the central North Island starting off in red in the traffic light system when the advice seemed to be that orange was the right colour?
If you're looking at places like the Waikato and heading out east, vaccination rates played a big role in that decision, but also the emerging nature of the outbreaks that we were seeing in that area. So Waikato have been dealing with an outbreak that definitely had a bearing on the decision making there.
I find it weird a little bit, Chris, because we are sort of 90% double vaxxed, especially up here. ICU isn't understrained and our case numbers are falling, which for us was always the case. What I do want to talk to you about, though, is a lot of us are going to be heading to small beaches, to lake homes and everything over the Christmas period. Will testing be widely available and on public holidays over that holiday period? What assurances can you give us?
Yeah, look, testing and vaccination will still be available over the holiday period. It might not be available on exactly the same scale. Rapid antigen testing, you'll see that's going to play a bigger role, particularly in some of those surveillance tests. So, for people crossing borders and so on, or crossing that Auckland boundary. So you'll see rapid antigen tests being made much more widely available as well. That's going to be really integral. So yes, the testing will still be available there, but people may have to, it won't be in absolutely every town. Sometimes, some towns don't even have a dairy. We'll be working to make sure we make it widely available over the summer break.
COVID-19 Response Minister Chris Hipkins, we thank you so much for your time this morning.